Hey, Alpha Nurses, and Licensure from alphanurseguide.com. This is 20 practice questions. With out the way, let's get started.
Question 1. A client arrives to the surgical nursing unit after surgery. What should be the initial nursing action after surgery? 1. Patency of the airway. 2. Dressing for bleeding. 3. Tubes or drains for patency. 4. Vital signs to compare with preoperative measurements. The correct answer is 1. Patency of the airway. Rationale. If the airway is not patent, immediate measures must be taken for the survival of the client. After checking the client's airway, the nurse would then check the client's vital signs, and this would be followed by checking the dressings, tubes, and drains. Question 2. The nurse is monitoring an adult client for postoperative complications, which is most indicative of a potential postoperative complication that requires further observation. 1. A urinary output of 20 milliliters per hour. 2. A temperature of 37.6 degrees Celsius, 99.6 degrees Fahrenheit. 3. A blood pressure of 100/70. 4. Serous drainage on the surgical dressing. The correct answer is 1. A urinary output of 20 milliliters per hour. Rationale. Urine output is maintained at a minimum of at least 30 milliliters per hour for an adult. An output of less than 30 milliliters per hour for each of 2 consecutive hours should be reported to the surgeon. A temperature more than 37 degrees Celsius, 100 degrees Fahrenheit, or less than 36.1 degrees Celsius, 97 degrees Fahrenheit, and a falling systolic blood pressure less than 90 are to be reported. The client's preoperative or baseline blood pressure is used to make informed postoperative comparisons. Moderate or light serous drainage from the surgical site is considered normal. Question 3. The nurse monitors the postoperative client frequently, knowing that accumulated secretions can lead to which problem? 1. Pneumonia. 2. Fluid imbalance. 3. Pulmonary edema. 4. Carbon dioxide retention. The correct answer is 1. Pneumonia. Rationale. The most common postoperative respiratory problems are atelectasis pneumonia and pulmonary emboli. Pneumonia is the inflammation of lung tissue that causes a productive cough, dyspnea, and crackles. Fluid imbalance can be a deficit or excess related to fluid loss or overload. Pulmonary edema usually results from left-sided heart failure, and it can be caused by medications, fluid overload, and smoke inhalation. Carbon dioxide retention results from the inability to exhale carbon dioxide in clients with conditions such as chronic obstructive pulmonary disease. Question 4. The nurse is caring for a postoperative client who has a drain inserted into the surgical wound. Which action should the nurse avoid in the care of the drain? 1. Check the drain for patency. 2. Observe for bright red, bloody drainage. 3. Maintain aseptic technique when emptying. 4. Secure the drain by curling or folding it and taping it firmly to the body. The correct answer is 4. Secure the drain by curling or folding it and taping it firmly to the body. Rationale. Aseptic technique must be used when emptying the drainage container or changing the dressing to avoid contamination of the wound. Usually drainage from the wound is pale, red, and watery, whereas active bleeding will be bright red in color. The drain should be checked for patency to provide an exit for fluid or blood to promote healing. The nurse needs to ensure that drainage flows freely and that there are no kinks in the drains. Curling or folding the drain prevents the flow of the drainage. Question 5. The nurse checks the client's surgical incision for signs of infection, which is indicative of a potential infection. 1. The presence of serous drainage. 2. The presence of purulent drainage. 3. A temperature of 98.8 degrees Fahrenheit. 4. The client complaining of feeling cold. The correct answer is 2. The presence of purulent drainage. Rationale. Signs and symptoms of wound infection include warm, red, and tender skin around the incision. The client may have fever and chills. Purulent material may exit from drains or from separated wound edges. Infection may be caused by poor aseptic technique or a wound that was contaminated before surgical exploration. It appears 3 to 6 days after surgery. Serous drainage is not indicative of a wound infection. A temperature of 98.8 degrees Fahrenheit is not an abnormal finding in a postoperative client. The fact that a client feels cold is not indicative of an infection, although chills and fever are signs of infection. Question 6. The nurse is assigned to assist with caring for a client after cardiac catheterization. The nurse should plan to maintain bed rest for this client in which position? 1. High Fowler's position. 2. Lateral position. 3. Head elevation of 45 degrees. 4. Head elevation of no more than 30 degrees. The correct answer is 4. Head elevation of no more than 30 degrees. Rationale. After cardiac catheterization, the extremity into which the catheter was inserted is kept straight for prescribed time period. The client may turn from side to side. The client is placed in the supine position, and the head of the bed is not elevated to more than 30 degrees to keep the affected leg straight at the groin and prevent arterial occlusion. Bathroom privileges are not allowed during the immediate post-catheterization period. Question 7. The nurse is reinforcing home care instructions to a client and family regarding care after cataract removal from the right eye. Which statement made by the client indicates an understanding of the instructions? 1. I should not sleep on my left side. 2. I should not sleep on my right side. 3. I will take aspirin if I have any pain. 4. I should not wear my glasses until my surgeon says it's okay. The correct answer is 2. I should not sleep on my right side. Rationale. After cataract surgery, the client should not sleep on the side of the body that was operated on. Clients should be instructed not to take aspirin or any medications that contain aspirin because of their antiplatelet properties that can increase the risk of bleeding. Acetaminophen can be taken as needed for pain. Clients may wear their glasses. Question 8. After a liver biopsy, the nurse should place the client in which position? 1. Trendelenburg and on the left side. 2. Prone with the head of the bed in a flat position. 3. Supine with the head of the bed at a 30-degree angle. 4. A right sideline position with a small pillow or folded towel under the puncture site. The correct answer is 4. A right sideline position with a small pillow or folded towel under the puncture site. Rationale. After a liver biopsy, the client is assisted with assuming a right sideline position with a small pillow or folded towel under the puncture site for at least 3 hours. Options 1, 2, and 3 are incorrect positions. Question 9. The nurse is administering a cleansing enema to a client with a fecal impaction. Before administering the enema, the nurse should assist the client to which position? 1. Left Sims position with the head of the bed flat. 2. Right Sims position with the head of the bed elevated 15 to 30 degrees. 3. On the left side of the body with the head of the bed elevated 45 degrees. 4. On the right side of the body with the head of the bed elevated 45 degrees. The correct answer is 1. Left Sims position with the head of the bed flat. Rationale. When administering an enema, the client is placed in a left Sims position so that the enema solution can flow by gravity in the natural direction of the colon. The head of the bed is not elevated. Question 10. A client is being prepared for a thoracentesis. The nurse should assist the client to which position for procedure? 1. Sims position with the head of the bed flat. 2. Prone with the head turned to the side supported by a pillow. 3. Lie in bed on the affected side with the head of the bed elevated 45 degrees. 4. Lying in bed on the unaffected side with the head of the bed elevated 45 degrees. The correct answer is 4. Lying in bed on the unaffected side with the head of the bed elevated 45 degrees. Rationale. To facilitate the removal of fluid from the chest, the client is positioned sitting on the edge of the bed, leaning over a bedside table, with the feet supported on a stool, or lie in bed on the unaffected side, with the head of the bed elevated 45 degrees. Options 1, 2, and 3 are incorrect. Question 11. The nurse is assisting with the insertion of a nasogastric tube into a client. The nurse should place the client in which position for insertion? 1. Right side. 2. Low Fowler's position. 3. High Fowler's position. 4. Supine with the head flat. The correct answer is 3. High Fowler's position. Rationale. During the insertion of a nasogastric tube, the client is placed in a sitting or high Fowler's position to reduce the risk of pulmonary aspiration if the client should vomit. Options 1, 2, and 4 do not facilitate the insertion of the tube or prevent aspiration. Nursing question 12. The nurse is assisting with caring for a client after a craniotomy. Which is the best position for the client to be placed? 1. Prone position. 2. Supine position. 3. Semi-Fowler's position. 4. Dorsal recumbent position. The correct answer is 3. Semi-Fowler's position. Rationale. After a craniotomy, the head of the bed is elevated 30 to 45 degrees, semi-Fowler's to Fowler's position, and the client's head is maintained in a midline, neutral position to facilitate venous drainage. Options 1, 2, and 4 are incorrect positions. Question 13. The nurse is turning a postoperative client who had extensive spinal surgery on the previous day. Which turning intervention or position would be best for repositioning this client? 1. Log rolling. 2. Semi-Fowler's. 3. Sims. 4. 30-degree lateral. The correct answer is 1. Log rolling. Rationale. Log rolling is used to maintain neck and spinal alignment after injury or surgery. A minimum of 3 to 4 staff members is recommended to prevent injury to the client, and a draw or pull sheet is also suggested. Options 2, 3, and 4 do not maintain proper spinal alignment and could be harmful. Nursing question 14. The nurse is preparing to administer an intermittent tube feeding to a client. The nurse aspirates 90 milliliters of residual from the tube. What should the nurse do with the aspirated residual? 1. Hold the feeding. 2. Place it into a container for laboratory analysis. 3. Rain still the residual and administer the feeding. 4. Deduct the amount of the residual from a new feeding and administer that amount to the client. The correct answer is 3. Reinstill the residual and administer the feeding. Rationale. Unless otherwise instructed or if the residual contents appear abnormal, an amount of less than 100 milliliters may be reinstituted. Then a normal amount of prescribed tube feeding is administered. It is important to return the contents to the stomach to prevent electrolyte imbalances. Therefore, options 1, 2, and 4 are incorrect. Nursing question 15. The nurse is providing endotracheal suctioning to a client who is mechanically ventilated when the client becomes restless and tachycardic. Which action should the nurse take? 1. Notify the rapid response team. 2. Finish the suctioning as quickly as possible. 3. Contact the respiratory department to suction the client. 4. Discontinue suctioning until the client is stabilized and monitor vital signs. The correct answer is 4. Discontinue suctioning until the client is stabilized and monitor vital signs. Rationale. If a client becomes cyanotic or restless or develops tachycardia, bradycardia, or another abnormal heart rhythm, the nurse must discontinue suctioning until client is stabilized. It is also important to monitor the vital signs and the pulse oximetry. If the client's condition continues to deteriorate, then the respiratory department and healthcare provider may need to be notified. There is no data in the question that indicates that the rapid response team needs to be notified. Nursing question 16. The nurse is checking a client for the correct placement of a nasogastric tube. The nurse aspirates the client's stomach contents and checks its pH level. Which pH value indicates the correct placement of the tube? 1. 3.5. 2. 4.5. 3. 6.0. 4. 7.35. The correct answer is 1. 3.5. Rationale. If the NG tube is in the stomach, the pH of the contents will be acidic. Options 2 and 3 indicate a slightly acidic pH. Option 4 indicates a neutral pH. Question 17. A staff nurse is preparing to assist a charge nurse with removing a nasogastric tube from the client. The staff nurse should reinforce, instructing the client to perform which action? 1. Exhale. 2. Inhale and exhale quickly. 3. Take and hold a deep breath. 4. Perform Valsalva's maneuver. The correct answer is 3. Take and hold a deep breath. Rationale. When the NG tube is removed, the client is instructed to take and hold a deep breath. This will close the epiglottis, and the airway will be temporarily obstructed during the tube removal. This allows for the easy withdrawal of the tube through the esophagus into the nose. The tube is removed with one very smooth, continuous pull. Options 1, 2, and 4 are incorrect. Question 18. The nurse is assisting with monitoring the functioning of a chest tube drainage system in a client who just returned from the recovery room after a thoracotomy with wedge resection. Which findings should the nurse expect to note? Select all that apply. 1. Vigorous bubbling in the suction control chamber. 2. 50 milliliters of drainage in the drainage collection chamber. 3. The drainage system is maintained below the client's chest. 4. An occlusive dressing is in place over the chest tube insertion site. 5. Fluctuation of water in the tube of the water seal chamber during inhalation and exhalation. The correct answers are 2. 50 milliliters of drainage in the drainage collection chamber. 3. The drainage system is maintained below the client's chest. 4. An occlusive dressing is in place over the chest tube insertion site. And 5. Fluctuation of water in the tube of the water seal chamber during inhalation and exhalation. Rationale. The bubbling of water in the water seal chamber indicates air drainage from the client. This is usually seen when intrathoracic pressure is greater than atmospheric pressure, and it may occur during exhalation, coughing, or sneezing. Excessive bubbling in the water seal chamber may indicate an air leak, which is an unexpected finding. The fluctuation of water in the tube in the water seal chamber during inhalation and exhalation is expected. An absence of fluctuation may indicate that the chest tube is obstructed, the lung has re-expanded, or no more air is leaking into the pleural space. Gentle, not vigorous. Bubbling should be noted in the suction control chamber. A total of 50 milliliters of drainage is not excessive in a client returning to the nursing unit from the recovery room. However, drainage of more than 70 to 100 milliliters per hour is considered excessive and requires healthcare provider notification. The chest tube insertion site is covered with an occlusive dressing to prevent air from entering the pleural space. Positioning the drainage system below the client's chest allows gravity to drain the pleural space. Question 19. The nurse is assigned to assist with caring for a client with esophageal varices who had a Sengstaken-Blakemore tube inserted because other treatment measures were unsuccessful. The nurse should check the client's room to ensure that which priority item is at the bedside? 1. An obturator. 2. A Kelly clamp. 3. An irrigation set. 4. A pair of scissors. The correct answer is 4. A pair of scissors. Rationale. When the client has a Sengstaken-Blakemore tube, a pair of scissors must be kept at the client's bedside at all times. The client needs to be observed for sudden respiratory distress, which occurs if the gastric balloon ruptures and the entire tube moves upward. If this occurs, balloon lumens will be cut. An obturator and a Kelly clamp are kept at the bedside of the client with a tracheostomy. An irrigation set may also be kept at the bedside, but it is not the priority item. Question 20. The nurse is inserting an indwelling urinary catheter into a male client. As the catheter is inserted into the urethra, urine begins to flow into the tubing. The nurse should take which step next? 1. Immediately inflate the balloon. 2. Insert the catheter 2.5 to 5 centimeters and inflate the balloon. 3. Insert the catheter until resistance is met and inflates the balloon. 4. Withdraw the catheter approximately 1 inch and inflate the balloon. The correct answer is 2. Insert the catheter 2.5 to 5 centimeters and inflate the balloon. Rationale. The catheter's balloon is behind the opening at the insertion tip. The catheter is inserted 2.5 to 5 centimeters after urine begins to flow to provide sufficient space to inflate the balloon. Inserting the catheter the extra distance will ensure that the balloon is inflated inside the bladder and not in the urethra, which could produce trauma. Inserting the catheter until resistance is met could cause trauma to the bladder wall.
You can check out my study guides and reviews. Links will be in the description. Thank you for watching.